As the Ministry of Health and Sanitation, they continue for give status update about the COVID-19 at the country. Sarah Network then at the National Emergency Operations Center concerning the status update. Let we listen to the official spokesperson for the COVID-19 response team as it give the update.
With me in the room here, we have the government spokesperson for COVID-19, the Honorable Solomon Jamiru. We have other subject matter experts, Professor Fodesa and Dr. Kenny, and also Professor Givao. We'll start today's press briefing by asking the Honorable Minister to do the press briefing, the press statement.
Thank you very much, Harold. Thanks, colleagues, and thanks to the media for complementing the public outreach on the fight against COVID-19. Status updates for 23rd April 2020. Total confirmed cases, 64. There is one death reported of a 76-year-old male. Active cases at isolation centers, 54. Condition of confirmed cases, stable. Cumulative recoveries, 10. Number currently in quarantine, 702. Number discharged from quarantine, 1,236. Again, the public is reminded that it is mandatory for everyone to wear face masks in public places, and the enforcement mechanisms are in force. Thank you. Harold?
Thank you very much. And today, it has pleased the interim coordinator, Brigadier Kelly Conte, to announce the names of coordinators for the district emergency operation centers. And I will briefly read the names. Kenema District, Umaru Bandi, Kondo. Kainamu District, Mori Feka. Kono District, Samuel Sam. Bo District, David Fortune. Bond District, Joseph Mogboy Kamara. Moyamba District, Joseph Kendo. Ujam District, Mohamed Pana Bato. Bombali District, Mohamed Mogambo Siafa. Tonkolili District, Alusain Abdullah Sise. Kaine District, Fode Sidiki Kalon. Podloko District, Moses Eric Kamara. Koinadugu District, Abdullah Bayi. Western Area Rural, Victor S.O. Davis. Western Area Urban, Niata French. And Falaba District, Lansana Mamadi Konde. So these are the names of the district coordinators for the District Operations Center. Thank you very much. At this stage, we would ask members of the press to ask their questions. If you want to ask questions, you call your media house and your name, and we will take questions in rounds of 5. And we have the subject matter experts here in the room to respond to these questions. Thank you very much.
Hello, hello. Hello.
Yes, we can hear you.
Yes.
Yes, I am Amadou Lamnanaba. I work for AYV. My question is on the figures for today and the figures yesterday. On the infograph that is shared by the Ministry of Information. Yesterday, Western Rural had 8 cases. Today, it's 7 cases. And Western Urban had 43 cases. And today, it's 47 cases. If you check, and we have 3 confirmed cases. And if you check everything, it doesn't add up. So I just want some clarification on the numbers.
Okay. Next question.
Ibrahim Samora, SLBC. My question is related to the one death. We want to know whether that death was among the first, second of cases that we announced. Then also, my area of concern is the areas of discovery.
You mean recovery?
Yeah, you mentioned total about 10. But I want to, I heard the spokesman say they've discharged another people that have recovered from the coronavirus. So I want to know whether that has been done.
Thank you. Next question. Okay, we'll allow the subject matter experts to respond to these questions. First, on the infograph, the numbers not adding up. Yeah. So, Yema, can you just talk on this?
Thank you very much, Lamganaba. Yesterday, from the date, because we do not just bring up the numbers reflect what is on the database. So the figures you saw yesterday and today reflected the database. So there was a database error. Thank you.
And let me go through again as what you are saying. I can candidly tell you that Western Urban has 47 cases, Western Rural 7, from Potloko is 6, we have Tonkolili 1 and Kenema 3. If you put all this together, it is 64.
Yes, and there is a difference also between the cumulative cases, which is 54, and the active cases, those that are currently at the isolation center.
That is
so it is, that's the difference. So there are active cases in the infograph and also cumulative cases.
And the cumulative is 64.
And the cumulative is 64. Okay. Thank you. And then the other question relating to the death of, yeah.
Yes.
Okay.
Yes, the death that is being reported is of a patient who reported to the Connaught Hospital. Whilst on admission, the case definition for corona, he met the case definition, and then the sample was taken. But before the results came, then the patient passed away. So the patient was not admitted in any of our treatment centers. The patient was admitted at Connaught Hospital.
Then also that would be my concern, because I believe before that patient went to the hospital, there might be some kind of contacts within the family, within the community. So what EOC you've done so far, try to trace those families and also maybe relatives or individuals that might have come in contact with.
So I will answer that. You are actually playing into our own game. So immediately we got that alert. There is a surveillance person seated who actually alerted us. We alerted lab before the sample was collected. So immediately we get alerts, we go straight into investigation. And I will tell you for free, we have done all our contact line listing, and within the family around the area, there are 20 people that are contacts. Those people are already under quarantine within the family. Those who the patient met within the hospitals are also line listed.
No, this is the work of surveillance, and it's ongoing.
Surveillance is like a policeman investigating. So we can give you figure now, and within 15 minutes it changes, and it keeps changing.
Excuse me, I still need a clarification. If I can add, I still need a clarification. If Western rural, if Western urban is 43, is 47 today, and we have 3 cases, and Western rural is still 7 or 8. I need a clarification. What is the number of yesterday? What is the confirmed? Because with the cumulative cases and cases you are explaining, I would imagine the infograph normally gives information on the total number of confirmed cases, not the details you are explaining. which should add up.
Probably.
But if you check again yesterday data and today's
Okay,
data, it's not adding up.
We have your, yes,
So,
your
no,
point is being
wait,
made.
let him give us what he thinks he has.
Okay.
What is your own figure adding up to?
Lamrana,
Hello?
can you give us the figure that you have?
The sound from your end looks very, very low.
Okay, I will ask others to mute their mics, please. Please, if you are not talking, put your mics, mute your mics, please. Are you getting me?
I'm not hearing, I'm not getting any sound from your end, sir.
Hello, Lamrana, are you getting us now? Hello?
Okay, well, he will come to you.
Okay, let's continue later. But can you make the clarification, sir, so that maybe you get it?
Yeah, as of, because today, the samples, why I wanted him to add up, is possible we as epidemiologists, the way we take the things. For our own counting and for the graph we are drawing, the day we are taking it, the day one as the day we took our samples. Because if the result come out today, it's not today you are positive. It's today, yesterday that this sample was taken.
Yeah.
So as I'm speaking to you, the samples were taken yesterday. So it is yesterday. Samples are going to be taken today. It will come out tomorrow, but the day you took the sample. So maybe he is thinking that this 3 that has come out today should add up to the 64, I mean the 47, then make it to 50. And so that's why I wanted him to actually show what it is number. Yeah.
Okay. So let me help you a bit, Lamana. We've already admitted that there was an error on the database yesterday.
Okay, yesterday.
Yesterday, the database read 8 rural and 43 urban. However, that error was corrected this morning, and it's now reflective that the Western Rural should have reported 7 yesterday, and it is still reporting 7 today. The one that was added to the rural was an urban case, and that has been brought to the urban. So the urban, as of yesterday, should be reporting 44. And so, because there was this error, so the 3 that was added today now makes 47. So we apologize for the error. We will work very hard to ensure that we do not have such errors in the future. Thank you.
Yeah,
Okay.
just for a comment on Facebook, for those viewing live, there is a suggestion that when we read in English, let's also go down to Creole, because most people are watching us on TV, online, etc. So they want a mix of the analysis from the Honorable Minister also in Creole as well, so that our people there watching in the business places can also understand. So that's it for now.
Okay, noted. Noted.
All right, noted. Thank you.
The next one, let's.
Yes, Mr. Sumaila, we'll come to you, Samuel. Yeah.
Yes, somebody online, yeah? Please.
Okay, please.
Okay, Lucian.
Lucian Momo is online.
Okay,
so-
please hold on. Yes, Lucian?
Yes, good afternoon.
Yeah.
I'm Lucian Momo, LGT BSc. I have an observation and a question. My observation yesterday was that I attended a funeral at the mortuary. I did not see any semblance of social distancing, even amongst the security personnel around and the people. And also going to the Ascension Town cemetery, there was no security personnel, and the cemetery was really overcrowded with people. Even when someone was, talking about social distancing, these grave diggers were, they were rude to this place, saying COVID is not for them, and this and that. So I want to ask, what measures are you putting in place to ensure that the number of people, that should be at the mortuary and at the cemeteries is abided by mourners? Thank you.
Thank you.
Thank you, Lucian.
Yes, Mr. Thomas, and maybe also for the spokesman, I find it worrying for now because now we've got accumulative cases of 64, and the bed capacity, according to the Minister of Health, is about 100 bed capacity. So what are we doing now? Because you see the numbers are swelling, so we are worried about that, about the bed capacity. But also with the area of the testing kits, because we are getting reports that they are now in short, so we are worried, and now we are seeing the cases are coming up. Then also with the idea of recycling PPEs, that one is a concern to me because I don't know, I'm not a medical practitioner, but what I've learned during the Ebola outbreak, after using the PPE for a medical person, just deposit to the dustbin. But talking about recycling PPEs, I don't know.
Okay. Yeah. Yes, any other person? Yes, okay.
Yeah, my name is Larry Jackson. I'm voting for CTA. My question has to do with the update in terms of disseminating information. We find out that before the press conference, we already see updates on social media. And so what the COC have already put in place to make sure that they control the issue of disseminating information. Even yesterday, there was an update again in the evening. So I don't know what you have put in place. And secondly, have to do with a video clip making around social media, the area of the person in question. I want to confirm that if it is true of that particular video on social media yesterday.
Okay, thank you very much. I think we can respond to the questions before we move on.
Yes, first of all, let me see if I could... thank you, Lucien. Thank you for your question. So exactly the situation that we have is like you have a status quo, and all of a sudden you are introducing something that you would wish to call a new normal. How do you get people to evolve, to have a radical departure from practices of the past and adopt the new normal? It takes time. I mean, all over the world. I mean, there are countries, there are jurisdictions that are fighting with this. You go to some countries, people are still going to the beaches, people are still congregating, and it's becoming extremely difficult to see how persons can maintain social distancing. So our role within the communications outfit is to continue the public education around the fight against COVID-19, but also we expect to be complemented in huge part by the essential regulations and measures in force. We know that the Constitution has empowered the presidency and widely and largely the executive to take such appropriate measures that could help in the fight against COVID-19. It is our responsibility to make sure that we effect those measures. You have observed, and I think it's a very profound observation, burial places, but also people congregating in different places. We know, for example, it is now mandatory for persons going into public places to use their face mask. We would continue to monitor, we would continue to observe, and I'm sure the necessary agencies that are in charge of compliance will step up to this. But I think all of us should continue this, putting out the message and sensitizing our people about the dangers of COVID-19. Somebody spoke about the message. I think having message coherence is very important. It is within the context of the fight against COVID-19 and within the context of the public emergency. When we give timely and essential message, it helps us in the fight against COVID-19. And you know, it would appear as if it's very discomforting when by the time you want to have a press conference and do your usual update, perhaps there is so much thrown into the public domain and your work may seem redundant. There are standard operating procedures that are guiding us, but be rest assured we are also discussing this between and amongst ourselves to see what delicate balance we can strike. But all of us do agree that if we give you timely information, it equips you, it prepares you, it helps you to prevent, it helps all of us to fight the disease. So we may be recalibrating, but be rest assured we stay committed to timely provision of the necessary information. Colleagues?
Yes, so your question also, it was the Minister of Health was just mentioning in one of the press conferences that other countries are recycling PP, but it's not that we are doing that. We are not recycling. We have enough PPs at the moment, and that is why we are asking people to use cloth face masks so that we don't deplete the resources of the face masks for our health workers. So get this one very clear. And yesterday we talked on this, but it is not Sierra Leone. It was just mentioning that the situation is so bad that other countries are recycling PPEs. Okay.
Then on the bed capacity, you said the minister quoted that we have only 100 beds. Work is underway. We have now started work at the PMTC, that is the Prescription Training Center. In the next couple of days, we'll have 100 beds up and running. The same is being done up country in Bo, Kelima, and in other district headquarters. And also there are other institutions that have been identified. They are ready. We have like Public College, for example, we have about 151 beds ready to go. This can be kept for mild cases, especially healthcare workers. So, I mean, bed capacity is being increased. And somebody asked earlier on about recovery. Yes, we have 4 patients that will be discharging today. They are not being discharged, but they will be discharged today.
At one time.
I don't know, but they will be discharged today.
Yes, talking about test kits. To date, we have analyzed 1,423 samples. At hand, we have 1,900 test kits. It's a continuous process. We continue to procure more as time goes on. I can show you that if we tested 1,424 since the start of this outbreak, and we now have 1,900 kits, I think we are doing well. We still have some. And we are still procuring.
So we have enough because now it's always happening around the world. Flights are not moving. The movement of people have been restricted. So we don't know whether we have enough in stores for any eventuality of any overcrowding.
We are doing everything possible to get in test kits. And as I said earlier, at hand, today we have 1,900 test kits up and running.
If you have ask question,
Yeah, go ahead. Yes.
Please go ahead.
It's internet media.
so while Sakos in the wait, can I ask quickly? My next question is that I see we don't get 10 recovery cases. I go and ask, what's are the treatments when we give patient them? What's are the treatments when we give them?
Okay. Your
All right,
question
thank
will be
you,
answered.
Lamrana.
You want the answer?
Yes, Professor.
We don't give it.
The patient is ill. What is important is for the patient to get better. So really, I think we cannot give you that this is the recipe that we give patients for them to get better, but we make sure that we do everything possible to make sure that they get well.
What is it that you're doing? What is it that you're doing?
Taking care of them.
It's for reporting purposes. What is it that you're doing?
Just
that you're getting patients to recover.
Maybe you can just.
We don't have a vaccine. We don't have treatment.
No.
No, we cannot. I mean, we can just tell them that the healthcare staff is doing everything possible to make sure that we keep our mortality rate as low as possible. We make sure that they get better.
So there's a question from social media. The question reads, we constantly see on social media that people are self-isolating, and regularly we either see someone in the streets who we believe should be in self-isolation, and like the previous forthright case wherein the report came out that the person was on the run, only for that to be made public that the person was at the house of a relative at Mountain Court. And this week we have cases from Mountain Court. So do we need to trust people to self-isolate?
So what we have come up with is, for now, that in the phase we are in now, we are doing an enforced quarantine. What we mean, we go purely for managed quarantine. So on these cases that are contacts, be it high risk or low risk, we have endeavored to actually remove them from the society to a specific quarantine areas around the town. Yes, at a point we had self-quarantine, but now we have moved away from that. And in the case like what you have just asked, it is where Sierra Leoneans, we need to come up and be truthful. Because if you think you are a Sierra Leonean and then one case investigation goes to you to investigate, and you live at 25, be it Mountain Court, you give me one name. But then you tell me that you live at so place. You are not helping the situation. You are not helping the society. These are some of the things we are, we are actually coming across. So it's good that people really come out. I mean, from all indications, yes, this disease, people get it very early and easily, but it is not as deadly as the Ebola. All over the world, we are seeing people recovery. It is most people, like you hear of America, it's because there's too many in them and the type of people getting it. So we've now seen 10 people coming out. So I think that should instill some confidence in people. You don't have to be afraid. By doing that, you are endangering everybody in the country, including all of us, even you, the journalist.
Yes, we are seeing a hand up. Yeah. Can you ask a question, please?
Yeah, this is not a question, just like a concern. I'm Simon, I live in the United States. And so, congratulations for this kind of report you're giving to the public. But what I want to add, I'm sorry, I'm Deranis Jones, I'm living in the United States. So the data you're giving in the form of infographic is very good, but I would suggest we use the model that we're using in the US. Also, Fauci, who is the public health expert, is coming out to explain dynamics of the data. Because just as you had the journalist asking about the interpretation of the data, I want to suppose he's not a data analyst and he's not a public health expert. So he's unable to understand the dynamics going behind the data. So if we could have the public health experts being able to explain the data to the public, it makes a lot of sense and it reduces ambiguity and misinformation.
Okay.
Thank you very much. That's a valid point. Thank you.
Yeah.
Can I ask a final question?
And I hope your final is final, Lamrana. We know you.
Yes, final two questions.
No.
We understand that a positive, someone who was admitted at Connaught yesterday tested positive after they did the swab test. Is Connaught going to be quarantined as well, or those who came into contact with him? Because we saw what happened with Cottage Hospital, the PCMH Hospital. And finally, Mr. Minister, I want to ask what the status of the president, his family, and close staff that have been working with him. What their status?
Thank you. So I will address the last and ask my colleagues to speak to the first question. Hechi, the president, is doing extremely fine, and he's grateful to Sierra Leoneans for having him in our prayers and in our best wishes. Colleagues?
Yes, Connaught will not be quarantined because every institution in this country, I think, has an isolation center. So this patient was in isolation and the necessary precautions were taken. So Connaught will not be quarantined.
Thank you.
Yeah, no, very final for me also.
Okay, I think this is the final one.
Exactly. Now we are getting rumors making rounds in relation to the death of the first individual for this coronavirus. And they are saying that the wrong medicine was administered. For example, they mentioned chloroquine that led to the death of this patient.
It's not a treatment center.
I don't know.
Connaught is not a treatment center. That patient that died went to Connaught Hospital with other complaints. The patient went with cardiac problem, then had respiratory distress, and then because the patient actually, there were signs indicating that this patient was having signs of that fits the case definition, immediately that was why warranted the taking of the swab. So no drug was taken. Connaught is not a treatment center, so no chloroquine or no other treatment as you claimed was given to that patient.
And to be even clear here, I think since 2005, chlorine has been chloroquine have been stopped in this country as part of our drug list. So if we want to start using chloroquine, we have to bring it back through normal processes. It has to be on our treatment list as one of the drugs to be used in this country. So we cannot just overnight start using drugs. No.
All right. So thank you very much, everybody, for being part of this. And we continue in the fight against COVID-19. Stay safe, comply with the guidelines, and God bless you. Thank you.